The Assessment of Spondyloarthritis International Society S criteria for remission in axial spondyloarthritis, Axial SpA, aim to define a state of disease control. This is referred to as ASAS partial remission and requires that four key domains are simultaneously below a certain threshold. The ASAS criteria for partial remission in axial SpA require 1. Patient global assessment, score of 2 on a 10 scale. 2. Spinal pain, score of Korshto 2 on a 0 to 10 scale. 3. Function BS-FI, score of 2 on a 0 to 10 scale. 4. Inflammation, morning stiffness from AROS 2 on a 0 to 10 scale. The patient must meet all four criteria simultaneously to be considered in partial remission. This reflects a low disease activity state where symptoms are controlled, but it does not necessarily mean the disease is entirely inactive. For axial spondyloarthritis, Axial SpA, the ASAS criteria are the primary remission criteria. However, when considering remission criteria used in other rheumatological conditions like rheumatoid arthritis, RA, it is essential to clarify that there are no specific ACR, American College of Rheumatology, or EULA, European League Against Rheumatism, remission criteria tailored exclusively for axial SpA. Instead, remission definitions in axial SpA generally use the ASAS criteria as outlined earlier. Here's a summary of relevant details. 1. 1. ACR remission criteria. Specific to RA, ACR remission criteria are typically used for rheumatoid arthritis, focusing on tender and swollen joint counts, acute phase reactants, and patient global assessments. Application to axial SpA. These criteria are not commonly adapted for axial SpA due to the differences in disease pathology, e.g., enthesitis and axial involvement rather than peripheral joint synovitis. Therefore, the ACR remission criteria are not directly applicable to axial SpA. 2. EULAR remission criteria. Specific to RA, EULAR criteria often rely on disease activity scores like the DAS-28, which are more suited for conditions with peripheral joint involvement such as RA. Similarly, the DAS-28 and other EULAR tools are not designed for axial SpA due to the disease's distinct clinical features. EULAR does, however, support the use of the ASAS criteria in axial SpA management and outcomes. Why ASAS criteria are preferred for axial SpA? The ASAS criteria are specifically developed with the clinical features of axial SpA in mind, focusing on aspects like spinal pain, function, and inflammation, which are central to the disease. These criteria are more aligned with the natural course and treatment response of axial SpA, making them the preferred remission criteria in clinical practice. Therefore, when discussing remission in axial SpA, the ASAS partial remission criteria are the most relevant, as neither ACR nor EULAR have developed axial SpA specific remission definitions.